Welcome again to Graham Creek's travelling videos around Australia. At the moment I'm at a remote airbase in the far top end. And we've got response to an offshore rig, that's an FPSO. So I'd like to talk about procedural sedation. Procedural sedation is by placing a patient in an drug-induced state, either with a sedated drug or an analgesia, to make them more relaxed. We can use them in situations like difficult extrication, limb realignment, setting up IVs, inserting chest drains, transcutaneous pacing, synchronized cardioversion, maintaining ET in their airway to sedate the patient, I think. There are also other things, is management of people as well, behavioural management as well. So I'd like to talk about sedation and how we do it and what we use it for. So you have levels of conscious sedation, where the people are conscious to a level that they can still feel that slight pain and responding, they have good respiration, so they haven't lost their airway patency, and they have good cardiovascular output as well. So they reach the level of a state where they're still conscious of their surroundings, but their pain and that is diminished. So we can then do simple procedures. Right. So following on that, we can get a deeper sedation where they actually start to lose their consciousness in their airways and affects their cardiorespiratory system. So following on from that again, we may have another, which is general anaesthetic, which we don't want to go into that area at all. We're just trying to do a simple sedation of a patient for a procedure that we need to do to make them more comfortable, to make them be able to treat easier and then transport with minimal trauma to them. So first of all, sedation. What do we need? Well, we need facilities. We need like oxygen down here on our left. We need our drug kit, our drug therapy. We need our cannulas and airways. We need our monitor with Zol, our blood pressure. We may need our Parapack for ventilation. So we have all these things set up. Most of all, we need help. So we need help, and I'd like to introduce my procedurist over there. And over here we have my assistant over to the left here. As you can see, my assistant has the checklist, which is mandatory for all sedations. You have to have these people. They have to be trained as well in sedation to be able to assist you if something goes wrong. So then we've got to look at the patient. We have to have a patient that we have here. We have to assess them. We have to say, is the procedure warranted? Do we have to do it? Do we have to sedate them? What level do we have to sedate them? So we have to then assess their past medical history, their airways using the Mohs, the Lemons, the Malapati score, the rods. We have to look at all those things and document. We have to know when their last meal was, when they're fasting. All these things have to be documented on our checklist. So once we've documented, then we've got to work out what route of administration are we going to do. So are we going to do oral of simple sedative like an old diazepam, or are we going to do intranasal, intramuscular, IV, IO if it's needed, or are we going to do rectal or transdermal patches for sedation which are available? These are the things we have to look for, in particular the patient. The patient has to give consent to this procedure and sedation. They have to be explained to the risks and things that may go wrong and that we may have to do while they're sedated. So all these things have to be explained and documented that we've done this, and the patient has to sign the consent form as well. So let's look at the medications that we have to do. So the medications that we can use benzodiazepines for sedation. So sedations for the benzodiazepines may include some diazepam or may include some midazolam. So good drugs. Then we have to look at like analgesia sedation if they're in pain. So we may have to use as, say, morphine or a fentanyl. These are the drugs that you may only have available at your site or in your service. So it's good to understand the actions and the onsets of either intramuscular, intranasal, or a rectal administration. So calculating all those is important. So you're also going to have contact with either your telehealth, your operations centre, or your receiving hospital about what is appropriate for the patient, because the patient may have certain allergies and contraindications to this drug, and any other type of pre-medical history that may affect. Don't forget that sedation drugs and opiate drugs synergistically can work together and can onset the effect of sedation more severe and more depressed level of consciousness. We don't want them to go to that level. We want them to be comfortable at a level where we can perform the procedure. So we've got adequate facilities, we've got oxygen as a stone, we've got egress, we've got transport, we've got phone numbers, we've got everything that we have to do to prepare for this sedative process. Full explanation to the patient. So, are there complications? Well, of course there's complications. 1, we don't have the trained people. 2, we don't have enough drugs here, or all the wrong drugs here. 2, procedure goes wrong. All right, we don't have the appropriate facilities or appropriate resuscitation equipment. They're the things. The patient may have an allergy. All these things have to take out. Write a risk assessment of all the things. Document them on your checklist. It's important to do that. So what I'd like to do is take you through a quick scenario of sedation. So we're going to talk about this patient here. What's happened is offshore on the FPSO, which is about a 2-hour helicopter flight. He's fallen down a couple of steps and he's dislocated his left ankle. So, dislocation of the left ankle is an orthopedic emergency because it's closed tissue and the blood supply around this area is not supplied. So the tissue can become necrosed and die. This needs to be rectified. So obviously the offshore medic would have contacted the telehealth, initiated some pain relief, and probably would wait until either I got there or someone else got there. So we arrive on scene, landed, we get to converse with our other paramedic and our assistant and procedurist. But we find out this patient, 40-year-old male, past medical history, has gout, he's had GORD, gastroesophageal reflux. He hasn't eaten for 6 hours, which is really good. They've got him on oxygen, they're monitoring his blood pressure. He's got no allergies, which is really good. So let's look at this. However, he has one thing. He has a fear and a phobia of needles. Not good. So this changes our tact in how we're going to treat this patient to sedate them. So obviously we go for our checklist. We have our patient oxygenated during pre-sedation and explain things to him. So we give them the options, right? We could either do them intranasally, which with our fentanyl and midazolam. These can be done intranasally. First we reduce the pain, but we'd monitor how much pain relief he's had prior to and adjust the dose. He could have had just methoxyflurone prior to us arriving there, so we need to watch that. Then we'd have to give midazolam to a level to bring them down to that stage where we can reposition the ankle. However, these is one route we can go. The second route, which is probably not appropriate to him, would be rectal. And this we would explain again to him, that both drugs would be then one after the other inserted into the rectal catheter, injected. The onset may be slower, so we need to watch this, and the dose may be greater. So we need to consult with our telehealth doctor. So these are the forms that we have to discuss with the patient. However, we do have to then inform the patient that if anything goes on where there's an allergy, then we may have to give him a needle, but he'll be unconscious and sedated. So we need to explain that. So let's go for a summary. All right? Patient, injury. Do we need to do it? Right. Patient history, checklist. Right? Procedural staff that we need and assistance. Right? Discussion on good facilities, oxygenation, pre-sedation, during sedation, and recovery time. How long to transport time. Monitor up all these things, document everything you have. It's important for documentation. So, I'd like to thank you again for watching my training videos around Australia, and I'll see you next time. Thank you very much.